So I think what we're going to do is we're going to hand the podium off to Anita and Jacana, and they're going to do this. And Ashley and I will be coming in with a few questions and posing questions to the presenters and to the audience. So take it away.
Okay, so I think I'm going to be starting us off. So we're going to talk a little bit about our CalVEX survey. It's a state representative study of about 4,000 California adults. We collected data in May, June 2025. This is not our first round of CalVEX. We've done other rounds of it. This is our fifth survey in the series. And the VEX surveys, they collect data on physical violence, sexual violence, intimate partner violence, discrimination, economic shocks, firearm attitudes, mental health, and substance use. So it allows us to really think about violence in the context of people's lives a little bit more than some of the other data collection mechanisms have been around these issues. And we are able to do it in English and Spanish. I would be remiss if I didn't say that we give great thanks to Blue Shields of California Foundation. They have been, just a stalwart supporter of this work. And we're also able to collect demographics that allow us to have greater insight.
Before you go to, as we get to this slide, before you
Yeah,
talk about some of these, I'd love just to hear about how CalVEX came to be.
yeah. Uh, David asked the question but knows the answer because David and I have been working for a long time together, and he introduced me to people who wanted to, well, someone, Holly Kroll, who wanted to do a national study on sexual harassment. And they had a good survey. She knew the questions she wanted, and she had a good partner in a survey team. But they really wanted a researcher to be able to help guide consideration of these issues. And this was really, we called it was the Me Too study, was done in 2018. It was national, and David and I had a conversation. I had some startup money. David had some money from VALOR, and we said, okay, this is great nationally, but wouldn't it be amazing if we could also collect it specifically for California so that we could get state level estimates? Because when you do those national studies, yes, they give you the national estimates, but you can't get it down to the state. And so that really gave us insight into how much people wanted the data. There was such enthusiasm and interest. And Blue Shield in particular came to the table and said, we'd like to see this done again, but with a broader perspective of violence and the context of lives in which it's occurring. And so that was the foundations of the VEX survey. So in 2020, we went into the field for the first time to collect data on this broad array of violence experiences, understanding that they're intersected and that they're happening in contexts of economic insecurity, et cetera. Um, we didn't realize it. We went out in March 2020, and lo and behold, within the middle of the time frame that we were out in the field, it was COVID, and there was a shutdown. And a couple of things happened. Number one is that your response levels when people are stuck inside get really good, and so we had very good response levels, and we got our data rather rapidly. The other thing that happened is we could actually look in pretty real time what people looked like in the state based on the day we collected the data. So we were able we collected in the summer, and by September, we had our first publication, which showed that every day we were in the field, there was an increase in reports of mental health crisis. And from there, we were able to show that, yes, of course, the violence would exacerbate that risk. So very quickly we started to see this, real, oh goodness, we want these data. And so we don't usually do that data collection so quickly after, but we got funded again to do it in 2021. We got funded to do it in 2022. And we were actually in a position that was unlike any other state in the nation, which was we were able to see that the violence increased, and that wasn't specific to intimate partner violence, but we did see greater increases for women that included intimate partner violence. And so it was really great policy level data that we could have, and it was able to be used to to lobby, not by us, we can't lobby, we're researchers, to lot for our partners like David and VALOR to lobby for funding when there was a governor's surplus for domestic violence funding. That
And
was
so
very
what I
low.
love about is this started from the work you did with Stop Street Harassment, which was looking at a wide range of types of abuse. And so what you've and then you've been able to expand it to more types of violence. And I just think it's been a really great way to do it. So want you now we can get back to the slide and talk about the study, of what how you do the study.
Sure. Okay, so we partner with NORC at the University of Chicago, which is a survey research firm. This allows us, they collect the data. They have a very systematic way to do that. They get the IRB approval at the University of Chicago, and then they provide us with the data. They have a very strong history of doing this kind of work. The AP uses them, a lot of researchers use them. And what it allows us to do is to pretty rapidly get data collected using their probability panel, but they also have to use some non-probability sampling to be able to get this data to get the sample size we wanted, which is a pretty robust sample of 4,000 here. And it lets us do population level estimates. So we did 4,000 this year for a reason. We did it because we wanted to oversample for Black Californians, and I'm going to leave Jacana to talk about when we're going to release some of that data. But this is a reflection of what happened when we did 2023, where we did an oversample of Asian Americans. And we saw findings that were completely hidden by looking at just straight racial ethnic differences, but really allowed us to understand the diversity within the Asian American, Asian Californian communities. And this will allow us to do it with Black Californians as well. So our survey completion rate is about 25%. That's pretty average. And it takes about 15 minutes. The nice thing about the survey is they already have data on a lot of demographics, so we can take less time to actually get the information we need on a wider array of topics. So this just lets you know a little bit about the nature of the sample, that we have a little the representation of Hispanic is pretty good. We still, even with oversampling for Black respondents, it's still a little smaller than we'd like it to be, but it was because we got a big enough sample, it's allowing us to look at issues. We have in our data that 2% of our sample are not identifying as men and women or women. And that's really important because that's a group that's not identified in a lot of survey data sets and increasingly vulnerable to not being identified in any of our federal data. About 12% of people identify as lesbian, gay, bisexual, or other sexual orientation. We do have a pretty good age distribution. Obviously, you see that, a little bit bigger when you get to that 65 plus, and that has a lot to do with the fact that the availability of that sample is good. But we still have a really nice representation of the working age population of 25 to 44. The household income variation, you see, it's in a quintile, good representation of probably our middle and lower income participants. Education. So all of these are pretty consistent with what you see for California as a whole. So these are weighted, which means they are designed to be representative of our state sample. And so you can see that with about a third of the population having a bachelor's degree or higher. 15% are foreign born. 98% live in a metropolitan area, and 17% have a disability. I want to just highlight, we do have it's a very heavy urban to suburban population. That is very true of California, but it is a little bit underrepresentation of our non-metropolitan areas. Our foreign born looks pretty good, and reporting a disability, it looks pretty good with the state as a whole, representation wise.
So, Anita, before you go into the next part of this conversation, I wanted to just pop in briefly and see how many folks in our audience are familiar with the National Intimate Partner and Sexual Violence Survey, often referred to as NISFIS. We have the majority of folks in here have at least heard of it. But there are, quite a few of us who don't know much about it or who are not familiar at all. And so just to kind of share, I'm going to take this down. Give me one second. So, for those of you who aren't familiar, NISFIS is a national survey that has given us a clearer picture of sexual violence, stalking, and intimate partner violence in the United States. And it's helped us understand not only how common these experiences are, but who's affected and how they're affected. That's, really important, how violence is impacting people's lives. And so that information helps us make better decisions about both response and also prevention. And I just want to highlight for you that VALOR's national online prevention project, Prevent Connect, we hosted a web conference last month with CDC, who is the one who does the survey, to explore the latest NISFIS data. And those recordings are available if you're interested and you'd like to learn more, and I'll put a link in the chat. While NISFIS does include state data, having something designed specifically for California through CalVEX adds another extremely important layer. So, Anita, I'm going to hand it back to you, and it would be great to know, kind of hear how these two surveys connect and also where they may differ.
Let's talk a little bit about the differences and similarities between the CalVEX survey. NISBIS, it's a large national survey, and it really focuses on violence, sexual violence, intimate partner violence, stalking. It has victimization. It does not have data on perpetration. It has the data for women and men, so not not beyond that binary. And it's really strong for national prevalence and comparability across the states. In the CalVEX survey, we're able to cover a greater array of experiences of violence. So we have sexual violence, including harassment and assault. We have intimate partner violence. We have family and community violence. We have gun violence, policing violence, and discrimination, both institutionalized types of discrimination and everyday discrimination. With regard to experiences of violence, we include both victimization and perpetration. As you can appreciate, perpetration numbers can look relatively smaller because people still have to feel okay to disclose, but still, even with that, we do see notable numbers, and that's important to consider. And we also look at issues across the lifespan. So while NISBIS looks at ever and past year, we also look at ever and past year, but we also have a series of questions that ask about experiences in childhood and adolescence. And then we have these social and economic indicators that, and actually other indicators too, like political preference, and some of the others can be like the types of disability they have, occupation. There's some detailed data in that we're able to get because we're attached to a larger panel study that allows us to capture context, disparities, and lived experience. This really gives you the robust prevalence estimates and allows you to have these comparable state estimates, particularly NISBIS 2023, 2024.
So before we jump into this data, there's another similarity, or actually, I'd love to hear you, Anita, talk about the similarities and differences that NISVIS does and CalVEX does. And what NISVIS did is, instead of saying, "Did you experience a rape?" or "Were you assaulted?" it asked behaviorally specific questions that then people could be able to answer about their experience, which leads to better outcomes. And I think that I know we spent a lot of time in the design, and I had the event, being part of that process with you and looking at the design of the survey. And so I just think that it's worth letting people, to explore how CalVEX is similar and different than NISVIS in the way it asks its questions.
Yeah, so I would say that I would say that the strength of NISBIS is really their procedure is really tight. They do a two-stage design. It takes them a lot longer to collect the data. But what they're doing is when they collect it, they pay people to screen. It's not an existing panel. You get the money for the survey, and if they don't get it, they'll work to get contact with the person and pay more to be able to get non-respondents to respond. And so what you do is you get a better response rate. When you're not relying on an existing panel, in some ways this is like, it's more expensive, but you're getting people who are not like used to survey testing all the time, which can be a little bit of a better representation of a population. So they're really maximizing coverage and rigor. In contrast, we're using that panel-based data. We're able to do a shorter survey. It's a very small incentive payment, and it's only offered on the web. So, there's pros and cons. We can get the data back out to you really fast. We can get a greater variety of questions in there. We don't have our sampling, like their sampling is really strong. And if there's anybody from the NSVIS team that wants to add more about some of the ways that NSVIS is really quite comprehensive and important, and I can't speak enough to that, because I'm concerned about losing NSVIS, and I'm really excited about what VEX offers, but I think it's a complementarity. It's not something where I think it's one or the other that you should use. I really think NSVIS needs to stay, and this is an asset that can complement that national perspective.
Yeah,
Nice.
but beyond the sampling, I think that the way the questions are constructed are very similar in a way that they're really asking about people's experiences without going over to just rely on labels of did something
Yes.
happen to you.
Yes, and both are very behaviorally specific. And we can go to the slides of some of the behaviors that we've asked in each survey and how they kind of look in terms of the differences and similarities. Okay, so this is the other thing. When you do NSVIS, which is, it's a large survey, but when you're getting down to the state level, I don't know if it's 400, but it's between 300 and it's between 250 and 400 they're probably getting per state. I'm guesstimating about 400. It would be great if someone from NSVID confirmed this, but that's going to be a little bit bigger because California is just a bigger state. So you want to get it's a little easier to get the numbers, and you're probably going to get a little bit more representation. So just with let's just look at the issue of attempted or completed rape. I'm comparing that in CalVEX. We ask about forced sex, and what you can see is pretty similar estimates for women. Now, because the numbers are smaller in California, you can get that estimate at the national level for men, but you can't get it at the state level. We are able to get it at the state level because of our sample size, and it's 5%. Very notably, we get what we call gender nonconforming, so not specific to that binary of women and men. So those who identify, they could be identifying as non-binary, two-spirit, whatever, anything they want, trans, but not identifying as a woman or a man. They would be in this category of gender nonconforming, and we see here 19% have experienced sexual or forced sex. If we go down, you could see actually it's a little higher when you look at intimate partner violence, physical and sexual, for CalVEX relative to NSVIS. So one thing about the intimate partner violence, we ask a few more questions than NSVIS does on physical and sexual violence, and we include in our physical and sexual violence threats of physical violence, so not necessarily contact made, but the threat has been made. So that may explain why ours are just slightly higher. And again, we can see that gender nonconforming population, it's notably higher than men, but women are higher for intimate partner violence, and that's a really interesting finding in itself. All right, I'm now going to hand off to Dr. Thomas, and she will let you know about all the findings of the current study, or the 2025 study. Thank you.
Thank you so much. So as Anita has said, we are particularly focused in this report on 3 main types of violence, and then we're going to talk about their intersections and some of their drivers a little bit later. But when we look at the scale of violence in California, we see that it's quite staggering. So here, there are some statistics on lifetime experiences of these 3 different types of violence. And what we can see is more than half of Californians have reported in their lifetime experiencing physical violence, sexual violence, and intimate partner violence. And so this works out to about 16 million Californians with this experience, or an experience like this, in their lifetime. We also ask, as we'll kind of dig a little bit more into in some of the subsequent slides, about experiences with weapons. And what we can see here is that 23% of our respondents have noted that they've had an experience with violence with a knife or a gun. And so this works out to about 7 million Californians. And so hopefully what we're able to show throughout these slides is that violence in California is wide-reaching. It affects a lot of people in California across their lifetimes, And when we get into the past year violence statistics, we'll also see that even in the last year, lots of people have had very harrowing experiences with different types of violence, including with, in some cases, with weapons. So in the next slides, we'll kind of talk about each of these types of violence in turn. Starting with physical violence. So on the left-hand side, we see lifetime prevalence. So again, this is, have you ever experienced physical violence? And on the right-hand side, we ask in the last year, so these data were collected in 2025. So between 2024 and 2025, did you experience physical violence? So this figure shows us, it disaggregates the data by gender. And one thing that jumps out quite clearly in this figure, and you'll see carry over in all of the other figures that I'm going to show you, is that respondents identifying as gender nonconforming. So as Anita mentioned, those are people who say that they are non-binary, they're gender queer, gender fluid, or prefer to self-describe or other kinds of gender identities. They experience or they report high rates of physical violence, and we're going to see that with the other types of violence as well. So in over their lifetimes, gender nonconforming individuals experience 87% of gender nonconforming individuals experience physical violence. 52% of men experience physical violence over their lifetimes, and 49% of women experience physical violence in their lifetimes. So as noted a second ago, this works out to about 16 million Californians with this experience of physical violence. When we look at the past year, we see about 2 million Californians experience physical violence. And later on in the slides, we'll look at this over time, but what we'll see is that experiences in 2025, especially when we look at physical violence, are on par with what we saw during the pandemic, which we know was a heightened period of violence. And so one story that we're going to tell is that things have not necessarily gotten better writ large in California. So within the last year, we see that about 25% of our respondents that identify as gender nonconforming experienced physical violence in the last year, 8% of men and 5% of women. When we look at sexual violence, again, this the experiences of gender nonconforming respondents again pop out. They have outsized experiences of sexual violence both over their lifetimes and within the past year. But one thing we see that is a little bit different from between physical violence and sexual violence is that women on average experience more sexual violence than men, which is consistent with what Anita reported just a few minutes ago. And so what we do here is not only do we disaggregate the data by gender, we also disaggregate it by the type of sexual violence. So this question specifically asks about a range of experiences that people have had that fall within sexual harassment and abuse, and they can range from quid pro quo sexual harassment to forced sex, verbal sexual harassment, physically aggressive sexual harassment, and also cyber sexual harassment. And so one of the things that the data show us is that verbal sexual harassment is the most common overall, followed by physically aggressive sexual harassment. However, gender nonconforming respondents experience physically aggressive sexual harassment most frequently of all types of sexual harassment. And as we can see here, lifetime prevalence is again quite high overall. 35% of gender nonconforming individuals experience this kind of violence, 34% of men, and 2/3 of women respondents report this in their lifetimes. And so the third form of violence that we're going to highlight throughout this webinar is intimate partner violence. And so here we're specifically interested in violence that was perpetrated by a current or former romantic partner. And so we give respondents a list of things that could have happened to them, including they start at like humiliation to different forms of economic coercion, like withholding documents and withholding credit cards and money, physical harm, forced sex, and weapons-related violence. And again, this is violence that happens in the context of a romantic partnership. One thing that is not noted on these slides, but I want to highlight, is that many people reported experiencing potentially lethal IPV. About 2 million people experienced being choked or suffocated by a romantic partner within their lifetimes, and about 500,000 Californians, estimated 500,000 Californians experience firearm-related IPV. So that's intimate partner violence that included a firearm, which is potentially lethal. So what we're seeing in these data are, again, that about 16 million Californians have experienced IPV in their lifetimes. And within the last year, about 2 million Californians experienced IPV, with greater prevalence among gender nonconforming adults. As we can see, 82% of our gender nonconforming respondents indicated some form of IPV, with 57% of women experiencing lifetime IPV and 46% of men experiencing lifetime IPV. And within the last year, men and women have similar rates of IPV, both at about 6%. And within the last year, 22% of the respondents that are gender nonconforming reported past year IPV. Okay, so we'll stop here, and I'll hand it over to Ashley.
Thank you so much, Jacana. So, obviously we just had a lot of information laid out that gives us a picture of what is happening in California. And we're really interested in hearing from our audience about what additional data would you want to see? What would help you to know kind of beyond what we've already seen, to best support the work that you're doing around sexual and intimate partner violence. So would love to just hear from you all in the chat. What additional data would be helpful in your work? And there is more additional data coming, which is exciting, but we'd love to know, if there's something that maybe isn't here. Who knows, maybe that's something to think about for future iterations. So what else would you like to see? I see Gail says county level data would be helpful. Let's see. Richard is asking if NISVIS or CalVEX tell us anything about change over time. Julie says information about children in the home when IPV is present, so the impacts maybe on children. I would like to see data regarding family court and litigation abuse from Roman. And I'll just read out, Anita responded that county level data is hard, but we have it broken down by region of the state in the report. So I'll put the link to the report in again so you all can access that and find that information.
It's really important to get ideas of what type of research, what type of data you want to have, because this is what researchers use to be able to determine if something's going to be useful. It depends on the data set, but yeah, that can inform the types of questions and data collected. And so that's really helpful just to think about what data we're going to go into a little bit. Jacana is going to share more about some of the more detailed pieces here. Education levels of victims.
Yes, so one thing that, thank you for sharing the report again. And in the report, we have way more detail than we're able to, go through today in the report. But just responding to the question about people's experiences in childhood, we only sample adults, but we do ask people when they experienced violence. And what we're seeing is that just thinking about physical violence, 1 in 6 Californians experienced physical violence for the first time between the ages of 0 and 12. So before they were 12 years old. About 22% experienced physical violence between the ages of 13 to 17. And about a quarter of them experienced physical violence in their young adulthood, which is a particularly precarious time as well in childhood. And so if you're interested in some of these data points, we do have them in the report. Anita and I have actually been talking about ways in which we could at some point possibly survey children, but we're not there yet. And I want to note that the CalVEX only surveys adults 18 and older at this point, but we can ask about the time of their first experience. Do you want to add anything, Anita?
No, I put stuff in the chat. Somebody asked about witnessing, and so I put in the chat, it's about 1 in 5. We do have that. One thing to note is that we've put this around we've got it at 4 states right now. So we have it in Mississippi, Louisiana, Texas, and California, and that's super consistent. And it's been consistent in California since we started. So, I mean, it's about 1 in 5 every time we do the assessment that both for both men and women, that they saw their mother physically abused.
So there's a few pieces in here. One piece about for NISVIS that there's a change. Richard's pointing out, and this is true. There's a change in methodology so the state data reports from the 2010 or 2020 to 2012, and I guess also 2016 and 17 data can't be compared to the 23-24 data. So one of the pieces. So there have been changes in that methodology. So they want you not to be, you shouldn't be comparing that data. But a lot of with CalVEX, it's interesting if, um, while there's some changes in your design, how do you feel about you do compare data across years?
We do.
And so that's a piece and so once again, I love the point that Anita, you made earlier that this is a great that they're different data sets, and it's good to have multiple forms of data to be able to see where it aligns, to get it for different information and to be able to do it. And so I really see CalVEX as an incredible complement to NISVIS, and that we will come a little bit later in the presentation about thinking about what are some other forms of data people can have. The other comment that came up here was around sexual orientation, and I know NISVIS did put out a sexual orientation report, and in that report they showed very high rates for people who identified as bisexual, and so that was and I don't know, so they were just asking about
Same.
CalVEX and looking at that.
Exactly the same. We find the same exact thing, that highest risk is for people who identify as bisexual or other relative to gay and lesbian and heterosexual.
Okay. Why don't we go, Jacana, and jump more into some of the more data that we have here so we can get there.
Okay. Let's see. Okay. So one of the things, as I mentioned, that we have highlighted in this report, and specifically in this webinar, just because it's very glaring, is that Californians that identify as transgender, they face significant disparities in their violence experiences. And so one thing we can see here is that violence is disproportionate across every category. Respondents that identify as transgender, and also we ask in two different ways. So we ask people about whether they are identify as men, women, and then we allow them to either select genderqueer, gender fluid, as I mentioned earlier, non-binary or other. And so those are gender non-conforming, but we separately ask people if they have lived experience as transgender. And so among the people who have indicated that they have had lived experience as transgender, they also face very high disparities in violence, such that they experience significantly more violence than identify as cisgender across the board. Following on with some of the inequities, or actually going back a little bit, we wanted to understand better where this violence is occurring when people are experiencing physical violence and sexual violence. And so we gave a list, and people could select the places where they've experienced sexual violence. And one thing that jumps out quite clearly is, especially for women, homes are not particularly safe. And so when we look at both physical violence and we look at sexual violence, a lot of physical violence for women happens within their homes. 72% of those who experienced physical violence noted that the site of that violence was within their homes, followed by public spaces. And for men, it was 36% who indicated that their home was the site of violence, and 51% of men said it was in physical spaces, public spaces. So again, one thing that we're seeing is that women experience more violence within their homes, followed by public spaces, and for men, it is different. But then when we look at past year sexual violence, on the other hand, on the right-hand side, we see that for men, again, public spaces are the site where they experience greater sexual violence, and the second most is their home. And for women, public spaces and their home are pretty equally as dangerous. So I would say, again, sexual violence spans both these public and these private spaces, which is quite important. And so when we ask questions about who is perpetrating or who's causing the harm, one thing we can see again is that for men and women, the indicted perpetrator or the person who's the perpetrator here is quite different. So for women, 48% who experienced physical violence within the last year named their partner or their spouse as the person who abused them. For men, it was only 18% of men indicated that it was their spouse or their partner. But one thing we can see is that it's not always just the partner, it's other people who are often known to them, especially for women. So older family members, known non-family members, these are common perpetrators of violence. And strangers, only 14% of respondents that have experienced past year physical violence indicate that it was a stranger that did it. For men, on the other hand, we see that most commonly men are harmed by strangers, followed by then known family, known non-family or family members. And again, it's men are less commonly targeted for physical violence by their spouses. When we look at sexual violence, again, we see a slight difference for both men and women. The most common perpetrator of sexual violence is a stranger. This is what they most commonly report, followed by an acquaintance or someone within their community, and then known non-family members, followed by spouses and partners. So this is, I think, a particularly important slide here, and it kind of dovetails with some of the questions that were asked earlier about potential health outcomes. And one of the things that we've asked respondents, what were the consequences, the personal consequences for after experiencing physical and sexual violence. And for both men and women, we can see that anxiety and depression is the most common response, that after they have been targeted by physical violence or sexual violence, they become anxious and depressed, and women are much more likely to indicate that they experience this kind of anxiety or depression. But I want to juxtapose this with filing a complaint. And what we can see is at the top, so this is going in descending order by response, people are less likely to name a consequence of violence as filing a complaint. And so similar to what I think Katie Pfeiffer said earlier, there is a lack of reporting. People are less likely to file a complaint, and we can see that especially with regard to sexual violence. People are a little bit more likely to file a complaint with physical violence infractions than they are with sexual violence. But other common responses are that people had to change their routine. They had to end a relationship. People have missed work or school. They've stopped activities. And so this violence can actually be very disruptive to people's lives in a whole host of different ways. And so we were kind of thinking, we were looking at other kinds of disparities. One of the things that we're noticing is disparities across ethnic and racial groups, and also income groups with who is experiencing violence. Someone also asked a question about education levels and do we see disparities by education? And so this slide is kind of drawing out some of these data. So the first thing that we see on the top is that multiracial individuals in California experience the highest rates of violence, both physical, sexual, and IPV, followed by our Hispanic respondents and then our Black respondents. The bottom left graph shows us the violence, these three different types of violence, or I guess actually in this case, two different types of violence across socioeconomic status. And one thing that kind of is quite clear is that those in the highest income brackets experience the least physical and sexual violence. And we didn't see significant differences of IPV, however, by socioeconomic status and household income. And on the right-hand side, we again get a similar picture that those with college education, so those who are college education and have advanced degrees, they experience the least amount of intimate partner violence, sexual violence, and physical violence. And those with less than a high school diploma experience greater rates of violence. So again, we're seeing these violence disparities across income groups. So one question that was asked and that is frequently asked that I think is really exciting that CalVEX can answer some of these questions because we ask questions about perpetration. We ask people when have they previously in the past year and within their lifetime engaged in intimate partner violence. And so some of we broke it down, as I mentioned, in some of these subcategories: sexual violence or physical violence. And just some key findings here to note is that in the last year, approximately 500,000 Californians perpetrated some form of intimate partner violence. More than 1 million perpetrated some form of sexual violence, and almost 1 million perpetrated physical violence. What we can see here is that one thing I really want to home in on is that victimization is linked to perpetration as well. And so one of the things that we're seeing quite clearly is that individuals who indicated experiencing violence are more likely to also report perpetrating violence. So people who people are 28% more likely to perpetrate or to report having perpetrated physical violence within the past year if they also experience physical violence victimization. Respondents were 10 times more likely to report perpetrating sexual violence when they had a prior experience of sexual violence as well. And they were 4 times more likely to perpetrate IPV when they experienced IPV perpetration as well. Another thing that the data are showing us are that there is generally limited accountability. So as we noted previously, a lot of people do not file reports, but even more than that, people who perpetrated violence indicate themselves that there were no consequences of their violence. And so 52% of the individuals who perpetrated physical violence said that there were no consequences, and 46% of individuals who perpetrated sexual violence said that there were no consequences for them of doing this. When we think about maybe some of the highest consequences of violence and perpetrating this kind of violence, we see that only 11% of the perpetrators of physical violence and 6% of perpetrators of sexual violence reported being arrested. And we don't know what happened after that, but just looking at arrest, we can kind of see this. Next slide.
I just want to make
Sorry,
a
Anita
moment.
wants to go back.
I want to just go, and I want just to make how important this data is. And I just think that when we look at the issues of violence, we often look at victimization data, and most of the surveys are on victimization data. And I think it creates a really problematic frame that it makes it as if it's a problem of those who've been victimized, whereas the behavior that we want to stop is the perpetration. And so by being able to be asking these questions and getting this data really gives us something that's important, that there's over 1 million Californians in the last year that committed some form of sexual violence really speaks to why we need to be doing our prevention work and to show how widespread this issue is. And I really applaud CalVEX for having this data. In the United States, there's not much perpetration data that's been done from surveys. We've seen it in other countries, but I just really think that this is something that I encourage everyone to look at and focus on, and just really applaud having that in this survey.
I'm going to do the David thing where I know the answer to the question, but I'm going to ask you the question to kind of, what is the experience of gun ownership and gun purchasing? You did a great paper from the last round of CalVEX that I think relates to what we're seeing here.
We're going to get there in just a second.
Oh, good. Yay.
Yeah, so one of the things that I'm particularly interested in, and I think CalVEX as a group, we're interested in understanding gun attitudes, firearm attitudes, and purchasing behavior, and how that intersects with other forms of risks. And so we have a series of papers on this, some of which were just published. So we published a paper together on IPV perpetration and IPV victimization and subsequent firearm purchasing. And one thing that we found, which is quite clear, is that individuals who perpetrate IPV are more likely after perpetrating IPV to then go and purchase new weapons. And then we also see people who are victimized by IPV go out and purchase weapons too. And so we cannot conclusively suggest that they're doing this for protection, but after having that experience, people are going out acquiring new weapons, which raises the specter of this kind of fatal IPV that we're all really concerned about. But we'll get into the specific numbers of how many Californians own weapons, how many of them are trained to use those weapons, and maybe what are some of the implications of that. Okay, so someone asked about tracking the data over time, and what we're looking at in these two figures are past year physical violence over time and past year sexual violence over time. And one of the things that kind of stands out is that especially with physical violence, it climbed up to a peak in 2022. And in some ways, it was really exciting that in 2023, we see a dip in violence, so a post-pandemic dip, but we're back up to those pandemic levels now in terms of physical violence. Which, as we're going to mention in a few minutes, means that we have to sustain these prevention and response efforts because violence in California has not really gone down. And COVID violence was, again, at its peak. It was high. And so now we're kind of high again. When we look at sexual violence, we can see that there has been a reduction in sexual violence between the COVID peak in 2022. So after that, it dropped, but it has not gone down since then. And so there is no significant difference in sexual violence between 2023 and 2025, with one notable exception. There is a reduction between 2023 and 2025 in cyber violence, cyber sexual harassment. But overall, writ large, we do not see any decline in sexual violence between 2023 and 2025. And so one thing that we wanted to look at is whether Californians in different parts of the state are having different violence experiences. And so at first blush, we can clearly see that certain regions have higher prevalence than others. But one thing I want to note is that in every region, nearly half of the respondents in that region have experienced some lifetime physical violence, IPV, or high rates of sexual violence. And so that we can't say that some regions are great, but we do see variation in prevalence across the regions. And so one thing that stands out is that Northern California across the board has the highest prevalence rates, followed by Central Valley, and Southern California has the lowest rates of lifetime physical violence and sexual violence, but the Bay region has the lowest rates of IPV, followed by Southern California. And so there are some regional patterns here that we can kind of glean, but what I don't think the takeaway here is that some regions are great and don't have a problem that can be solved and others do not. I think all of the regions need attention in this regard.
All right, so we'd love to turn it back to our audience. And I know, I mean, there's been so much conversation in the chat and just questions and thoughts happening. So thank you all so much for engaging with us. We're wondering if, thinking about your experience and the work that you do, what have you seen that's happening around people? So not to people, but around people. Like what's happening in people's environments that might increase the risk for violence? And I know that one of the fabulous things about CalVEX is that we're going to be able to get some of that information and glean some of that, but would just love to hear from on the ground experience that you all have seen. So I see housing and food insecurity, which, yeah, I definitely, when I think about my experiences, I would include that too. Julie says political rhetoric. Roman says social media becoming more and more problematic. Thank you so much for these. And Jocana, while other people kind of think and put things in, I'd love to hear what you all have found in terms of kind of like the social context of this violence.
Okay, so there are three or four drivers that we're going to highlight, and these are by no means the only ones. We highlight more in the report, but these are some of the ones that pop out. And as we'll note later, we do have a really nice one-page infographic that if these are findings that resonate with you, it could be helpful for your work. You can use these and disseminate them later. But one of the clear findings of CalVEX 2025 is that economic instability really affects individuals' risks of violence. And so we ask about several different types of economic insecurity or precarity. And what we can see across the board is adults that experience food security, eviction, or homelessness report 3 to 5 times higher rates of past year physical, sexual, and intimate partner violence compared to those that did not face those same economic shocks or risks. And so on the left-hand side, we ask about the individuals who experienced food or bill deprivation, so they didn't have enough money for their basic needs. And what we can see is those individuals were 3 times greater, for example, to experience physical violence and IPV than if they did not have food or bill deprivation. We can see a huge effect of eviction. So those who recently experienced an eviction as a shock, they are significantly more likely to have experienced physical, sexual, and especially intimate partner violence compared to those who did not experience that shock. And lastly, individuals who were homeless within the past year were substantially more likely to experience those 3 forms of violence compared to people who did not experience that shock. And so clearly economics are driving a lot of people's experiences, or at least strongly affect people's experiences with violence in California. We also ask people about perceptions of their neighborhood and their experiences in their neighborhood. And we kind of break these down into 3 big broad categories of discrimination, neighborhood safety, and policing. And so what we can see is that people who have had these experiences with report discrimination, think their neighborhoods are unsafe, and have had unfair experiences with the police. They are 2 to 5 times more likely to report one of these different types of violence. So in the first box here, we can see that people that report everyday discrimination. And so everyday discrimination is quotidian discrimination on the street by other people where they believe that people are discriminating against them, maybe for the way they look, their accent, it could be their sexual orientation. So people who reported that form of discrimination are 5 times more likely to report physical violence, 4 times more likely to report sexual violence, and 3 times more likely to report IPV. We also ask about institutional discrimination, which is something like, I was unfairly passed over for a promotion or a job opportunity. I was unfairly stopped by the police. I was denied a mortgage loan, or I was unfairly denied a promotion. People who indicate that they've experienced that kind of discrimination overall face 3 times the rate of these 3 forms of violence. Again, we see relationships with police mistreatment. Those who experience police mistreatment on their last interaction are significantly more likely to experience physical violence, as well as sexual and IPV. And finally, individuals who personally think that their own neighborhood is unsafe, they experience greater 2 to 2.5 times greater rates of violence than those who do not believe that their neighborhood is safe, or conversely, who believe their neighborhoods are safe. Okay, and so these are some of the key drivers that we focused on in this report. As I mentioned, please feel free to peruse the report for other kinds of intersections. But we wanted to switch gears to thinking about the consequences, as we started to touch on a little bit earlier. And one of the things that we're seeing is that experiences of violence, they have large consequences, whether they're reported or not, right? Whether there are consequences for the perpetrators or not, they have consequences for the people who experience that violence, especially when we think about behavioral and mental health. And so we asked people about their experiences with severe depression and anxiety, serious suicidality, so seriously considering suicide within the last year, binge alcohol use, and illicit drug use. And what we can see across all 4 of these figures is that individuals that experience violence within the past year, be that physical, sexual, or IPV, they're more likely to report severe depression and anxiety, significantly more likely to have considered suicide within the past year. And I'd specifically like to draw attention to IPV here. 33% of the people who experience 33% of the people who experienced IPV in the last year reported seriously considering suicide compared to the people who did not have that experience, which is only 5%. We also see binge alcohol use and illicit drug use having these outsized effects on people, or I'm sorry, violence having these outsized effects on people's use of violence and illicit drugs. Okay. So Anita kind of primed this question already, and as I mentioned, this is something that we're particularly interested in. We have a couple of briefs on this. We are preparing one right now specifically on gun violence restraining orders and domestic violence restraining orders as like protective orders. But we asked questions in the last couple of CalVEXs about firearm ownership. And what the data show are that 22% of respondents indicate that they own a firearm, and but this is 46% among respondents identifying as gender nonconforming. 6% of respondents indicated that they recently purchased a firearm, so within the last year. And one thing that we noted is that those with recent exposure to gun violence, they're 4 times as likely to purchase or acquire a new firearm than those that do not have that experience. And just comparing the first statistic with the third one, 22% indicate that they own firearms, but only 19% indicate that they've received any kind of training on how to use their firearm or safe storage. And the last point to mention is that 61%, although several people or many people do own firearms in California, 61% say that they would prefer not to keep their firearms at home, right? And so I think that this indicates that although there is a significant uptake in firearms, there is broad support or broad preferences for not having firearms within their homes, which I think there are lots of questions, and I'm really happy we're going to move to implications very soon to hear about what you guys think about what these data suggest and the implications that we should draw from them.
So, both Anita and Jacana have presented us with so much information about what is happening, who it's happening to, where it's happening, what else is going on when it's happening. And so just kind of thinking about everything that we've heard so far today, interested to hear what recommendations or implications these data are suggesting to you all. You know, as we've been listening, have there been ideas coming up? Have there been things that, you know, you just feel like, okay, this needs to happen based on what I'm hearing? So would love to hear from you about that. And also want to encourage you all, I've put it in the chat a couple of times, I'm going to put it in again, but because the CalVEX data is able to get to us so quickly, just want to encourage you all to join the mailing list so you can stay up to date on updates and things happening around CalVEX. I just put that link in the chat. We really love to hear from you all about your recommendations or implications around what these data are suggesting to you. And maybe while folks are thinking, Jacana, we can move on and we'll come back and see what kind of themes are coming up.
Okay, so there are many more things I think takeaways from the data, but we highlight just 5 here in the interest of time. I think the first one is quite clear and obvious to me, that it's very important that we're able to sustain state funding for prevention and survivor support. As we noted in the beginning, violence in California is widespread. It affects a large number of people, and it does not appear to be going away. It was not a fad during COVID. It is still here, and large numbers of people are experiencing violence. And so stable investment is really critical, especially as the federal government is threatening or actually cutting funding to things like the Victims of Crime Act and Medicaid and hospital-based intervention programs. And so just a little bit of data from one of our other reports. So in 2024, we wrote a brief about the cost of intimate partner violence in California, and we paired with 2 experts at the Brookings Institute. And what we found is that IPV based on 2023 data, IPV costs California about $73 billion a year. So that's about 2% of the state's GDP in kind of reactive responses. And so these reactive responses include things like police responses, carceral cost, the toll on economic productivity, and healthcare. However, the amount for prevention pales in comparison to what we spend on reactions, right? So, for example, in 2024, this report came out in 2024, the Domestic and Sexual Violence Prevention Grant Program received about $2.3 million in funding. So to juxtapose $73 billion and $2.3 million, we can see there's kind of a shortfall in this kind of preventative funding, which is going to have to be made up for by this reactive funding. And so in one way, our contention is that by investing in prevention, maybe we can forestall some of these reactive costs that California foots the bill for in responding to IPV and other kinds of violence. Another thing that we notice in point 2 is that it's important to reduce violence and discrimination against individuals that identify as lesbian, gay, bisexual, transgender, queer, all of those things. And we show that in the report 3 different data points. The first one is that gender nonconforming individuals experience outsized rates of violence. Transgender respondents do as well. And someone had asked a question about individuals that identify as LGBTQ or other self-described sexual identities. They were more likely to have experienced, for example, substantially more physical violence within the past years. 14% of respondents that identified as LGBTQ plus reported physical violence compared to 6% of heterosexual Californians. So more than twice as much violence within that community. And so we believe, and we explain a little bit in greater detail in the report, that it's important to prioritize violence reduction mechanisms, including things like anti-bullying policies in schools, focusing on crisis hotlines that have gotten defunded recently federally, and other kind of affirming supports for specifically youth. The third one, which I think comes across very, very clearly from one of the driver slides that we focused on, is that as we're thinking about prevention, we should also think about its intersections with economic stability, and specifically centering economic stability in violence prevention. As we show those who have experienced recent shocks, such as housing insecurity, food insecurity, but then we can also think about other kinds of insecurities, such as, or economic costs, such as energy and childcare costs. They experience greater violence of all sorts. And so efforts should try to support economic independence. So we have a recent brief on sexual exploitation and quid pro quo sexual exploitation that shows that individuals who are or have dependencies, or whose economic livelihoods depend on others, are at greater risks of this kind of violence. And so thinking about supporting economic independence is quite important. And then based on some of the last couple of slides that we talked about, it's important to address discriminatory and abusive policing, because as we've talked about, many people who have experienced recent negative interactions with the police experience other forms of violence. And we also see that people are loath to report violence to the police. And part of this is because of potential abusive policing. And so we think it's important to invest in generally non-carceral responses. And so that can be social workers, health educators, victim services, and to expand reach. And then the last thing that we didn't spend a whole lot of time talking about, but we are going to talk about in some of the other briefs and reports that we're doing from CalVEX, we think it's important to strengthen firearm safety. People are going to own firearms, but they should be properly trained in how to use them. And so we would hope that we could expand training, safe storage education, and other kind of risk reduction tools, such as domestic violence and gun violence restraining orders. And so we have a brief that's coming out that looks at other VEX states alongside California, and it shows that many people do not understand that the DVRO and the GVRO is a tool that can be used to, on a limited basis, remove firearms from people that are at risk of engaging in physical and intimate partner violence. And that is a tool that we have here in California and in other states as well, and can be used to kind of help prevent at least gun-related IPV. So those are some of the implications. But as Ashley said, we're really happy to think about other things that we have not that are not on our radar. We're constantly collecting data and developing new reports. And we'd be interested to hear a little bit more about what you think we should be focusing on in subsequent iterations of both the CalVEX data, the broader VEX initiative, which we're going to talk about in a second, and just in the outputs that we produce from this. Okay, so we mentioned a couple of times some other pieces of outputs that we have. So two things that we just released from our broader CalVEX report, which is much longer, we have two one-pagers thinking about key findings from the CalVEX report. On the left-hand side, we have a infographic looking at gender-based violence. On the right-hand side, we have key findings focused on factors associated with violence, some of the things that we've talked about with like economic shocks and past year violence. It talks a little bit about victimization and perpetration and firearm acquisition. These data, as well as all of the data that we collect at CalVEX, are publicly available. We would love it if you would use these infographics or anything that we produce in your own work, in your own advocacy work, and anything that you're doing. It's up on our VEX website for you to download. We have other infographics. We'll constantly be uploading these. As I mentioned, the full CalVEX report is available. If you're interested right now, you can use the QR code on the right to access the report we've been talking about. And Ashley has also dropped the link in several times, so you should be able to download that quite easily. And on the left-hand side, we have a QR code for our LinkedIn page. We have a quite active team on LinkedIn. They're putting out these one-pagers regularly. They're highlighting when our colleagues, Leanne Arata, recently testified in Sacramento. We highlight that kind of information. We talk about the new data that we're collecting. And so we would love to connect with you on LinkedIn. And there will also be a link at some point to join our mailing list. And we would be happy to blast you with all of our reports and infographics and all the things that we have if you're interested. So we encourage you to engage with us. One other thing to mention is all of our data are publicly available. So if you are interested in analyzing some things that we have not yet talked about here that are not in the reports, you can download the data from OpenICPSR and you can use it for advocacy, but you could also use it for your academic research. And before we end here, I just want to talk about two really, really exciting things, or three really exciting things. One of the things that we have been working to do at CalVEX is to expand CalVEX to a broader VEX initiative. It's very helpful for us to understand violence in California, but sometimes it's useful to juxtapose that or compare that to violence in other regions. So Anita at the Newcomb Institute, she's in Tulane in Louisiana, first started collecting data in Louisiana to understand what was happening in that state, and expanded in the Gulf South to now there are data on Mississippi and there's data on Texas. And so we can compare California, and so things like uptake of GVROs and DVROs across these different policy contexts. And then we also got generous funding from the Blue Shield California Foundation to do a broader national survey. And so we have the same questions that we asked on CalVEX and these other state VEX surveys to ask us a national sample of American adults about their experiences with violence. And so we're going to do a release with this one soon, and that would be more directly comparable to the national NSVIS data, but we have all of the same kinds of questions. We have the same demographics in that survey, and this report is almost ready to be released. And then the last thing I wanted to mention that picks up on what Anita mentioned earlier today is that we oversampled on the Black community in California, because when we did that for the Asian American and Pacific Islanders in the previous version of VEX, a CalVEX survey, we were able to dig into some of the nuances and see how different communities within the AAPI community experience violence. And with survey methods, it's really hard to get an accurate assessment of what's happening in the Black community in California because the numbers are relatively small. And so we oversampled on the Black community, and we're going to preview our Black CalVEX report. Tentatively, this is going to be a large launch, hopefully in Oakland in September, at the beginning of at the beginning of the fall, and we're going to pair this with a listening session. And so we're inviting our community partners and any community organizations that are interested in engaging with us. We're going to preview the Black CalVEX findings, and we are planning to go into the field to do some qualitative work to kind of buttress these quantitative data. And so what we want to understand is here's the questions that we plan to ask, and we want to understand what questions are important to you that maybe we're overlooking, or how might we ask them in this specific context. So if you join our mailing list, you'll get all the notifications of these things that we're doing at VEX, and we would love to engage with you. So feel free to shoot us an email, join us on LinkedIn, join our mailing list. Thank you so much.
Thanks, Jocana. There's lots of comments in the chat about wanting presentations in various people's places, and then also around looking at the Black CalVEX report, wanting to partner. So YWCA Greater Los Angeles, and Emma talking about supporting the Oakland launch.
Add one more thing. So we have our legislative specialist Valet on the call. So we would be really excited to engage with you, and her job is specifically to do outreach and to connect. And so we have someone who can reach out to you, or you can reach out to us, and they can organize presentations or help or we could think about ways in which our data can be specifically tailored to your organization if you'd like us to do presentations. So please feel free to email me or look on the VEX website and email the general VEX email address. Jennifer Valet, if you know what that email address is, the VEX org email, feel free to drop that in as well. Thank you so much.
Thanks, Jocana. David, I think we have one more question, so I'm just going to put it in the chat because, it sounds like people have a lot of ideas, inviting Jocana and Anita to present. What are your plans for using this data to support your work? We'd love to know. And David, I want to pass it back to you for some closing thoughts, and I'll see what comes up in the chat.
Great. So I'm having people, so great. So we just love to get a sense of what this, how does this support your work? What are some of those next steps that you're taking? That's really exciting. I'm really blown away by this research, and feel it really is an important contribution for us. And I think we need to think about how we use this data. We talked about in concert with NISFIS, in concert with other data that we have available. It could be the service data that organizations do. If you're at a university, you could be trying to think about what's available there. And to be able to, and then I love the point about storytelling, to use the data to help advance the stories so we can understand what's going on, and then move towards solutions that are going to really be able to prevent all forms of violence. And so what CalVEX does is gives us another point and another place of doing it. And as you can hear, brilliant researchers who are involved in really thinking about this and having more coming up. I see people coming up with, or advocating for a grant program, so people are advertising for that, and someone who's doing research wants to be able to bolster to get a better data ecosystem of what we can be able to do things. We are in a time when sometimes it's harder to collect data, so the ways that we can take advantage and use the data that we can move forward really is going to strengthen our work. What we want to do at VALOR is help advance all of your efforts, and this is in concert with people like the CalVEX team that and many of you on the call here are really committed to being able to strengthen that. I know we're at 1 minute left to go there, so just want to encourage you to do this. I want to really thank Jocana Thomas from UC San Diego. I want to really thank Anita Raj from Tulane University. I also want to thank Ashley Dana, who on the back end is doing a lot of the work. And I really want to thank all of you who are here, who are doing the work in California and throughout the country. We want to be able to help continue advance how we do prevention work and work to end sexual violence and all forms of violence. So thank you all so much.